So one of the most pressing problems right now, perhaps the most pressing at this very moment, is just protecting frontline healthcare workers from getting infected. That's both a matter of their own safety and their family's safety, and also for the safety of public health. In Wuhan, China, and in parts of northern Italy, large numbers of healthcare workers contracted coronavirus, even with protective equipment, and then got sick and were not able to provide care. In short, if healthcare workers get sick, enough of them get sick, the whole system can crash. This is precisely why healthcare workers across the country are more or less jumping up and down screaming, raising the alarm. They either do not have access or are running out of protective equipment like masks, gowns, and visors, the very things they need to provide care. This is no longer some abstract fear. We are already getting stories about those workers getting infected, including our next guest, Dr. Dara Kass, an emergency room physician at Columbia University Hospital, who recently tested a registered nurse and president of National Nurses United. Dara, let me start with you and ask just how are you feeling and how did you find out that you had gotten the virus?
So I got tested, I had symptoms and I knew I was at risk because I had taken care of patients who had tested positive. So I went and got tested just to make sure that I was not going to take care of any more patients after I was positive. And I was confirmed last night. So I've been home in quarantine, actually still doing telemedicine because I feel pretty good, actually. I think I'm lucky so far.
I want to ask Deborah about what your concerns are for the folks in your union. I saw a protest outside a San Francisco hospital. I've seen reporting like this one, for instance, on the shortage of respirator masks. Federal health officials say respirator masks should be discarded after treating an infected patient. Many doctors around the country said they are being given just one to use indefinitely, spray it down with Lysol or wipe it off, not knowing whether that will help preserve it. Are you encountering situations like that?
We're encountering those situations all over the country and in Sonoma County where I live. People in construction are donating their masks to nurses, dropping them off at nurses' homes. And it's really alarming because we have been yelling about this for months and still masks are under lock and key. You have to go get a manager to get them. They're told to reuse them. Now the CDC is saying if there aren't masks, go ahead and make your own. Go to a craft store, get some felt or whatever you think might filter out this virus and feel safe and good about working in a store like that. And it's really become crazy. You wouldn't send a firefighter into a burning building with a squirt gun to put out the fire, and now that's what we're being asked to do here.
We should say here, Governor Andrew Cuomo has just been essentially pleading for creative solutions. He said New York has a critical need for personal protective equipment, including gloves, gowns, and masks, as well as ventilators. If you have or can make any of these supplies, New York is buying. I've heard of labs, construction workers trying to use theirs and donate them. Dara, as someone who is at the point of care in an emergency room, just describe to me first why it's so important and what the process is in terms of using the equipment when you've got a place where a lot of people, particularly in New York City right now, are coming who are infected, obviously, as you know.
Yeah, so the process is evolving as we learn more about the disease and we see the patients coming in different volumes. So we know that in the high risk areas, like the ICUs, when we're doing procedures that are really at risk, we have layers of levels of equipment that we use: full body protection, masks, gloves, double gloving, maybe goggles. If we're in a lower acuity area, an area that maybe isn't necessarily as high risk, we'll use maybe just goggles and masks and gloves. The issue is that every time you use the equipment, you're supposed to change the equipment in theory. And it's harder and harder to do that when we know we're going into this for weeks and months on end. And that's why it is encouraging to see leadership like Governor Cuomo asking for resources early before we run out in New York, because we will hit running out sooner rather than later. And we need everybody to chip in to help us get them.
Deborah, do you have clear communication from hospitals or from state public health officials or governors about what is being done on this problem? It seems to me this is a problem everyone's going to face, and you can't set localities and governors and hospitals to fight each other in a battle for a fixed supply. That's the worst possible outcome. So then you lead to hoarding. It's going to look like the toilet paper aisle in the grocery store, right? You need federal coordination. Is there any federal coordination?
Well, that's what we're extremely concerned about. President Trump signed the Defense Production Act, yet he's failed to implement it by demanding that corporations come up with better production lines for masks, for ventilators, for all the equipment. If you look at the other countries that are, some of them less well off than we are, their protections for their healthcare workers are far superior to ours. And it looks like they're managing to be able to protect their healthcare workers. And right now, that is not happening. We've had to even start a petition to the federal government to put protections in place and give us the equipment we need, or we won't be there.
Dara, two questions for you. One is, how are things in the emergency room you work in? You're not physically there, but in touch with colleagues in terms of what you're seeing right now, and as this pandemic has an epicenter in New York City. That's very clear.
I'm first and foremost so proud of the people that I work with, of where I work, because everyone is really putting all the patients first. They are trying so hard to take care of patients in an uncertain time, when they are putting their families on hold, when they're going to work, really just with the care of the patients first. You know, we are now officially the epicenter of the country in New York, and we are feeling it. We're seeing it on patients on the ground. We're seeing it with our admissions. These are numbers that the governor is putting out every single day, and we are trying to rise to the challenge. And I commend all the hospitals in New York City for doing that. But it is going to be a big lift for us, and it's going to be a long haul.
What about testing? I know this has been an issue for some folks, and I want to ask you both this. Not just personal protective equipment, but you really do need testing for healthcare workers. I mean, it seems just so urgent that you can't have healthcare workers who are positive caring for people, obviously, but you also can't just prophylactically take them offline when you need all hands on deck. And I've been hearing stories for 2 weeks about healthcare workers having a hard time getting tested. I'd like to hear from you, Dara, and you, Deborah, about what you're hearing. You first, Dara.
The truth is that we are doing the best with what we have. And I think this shows a lack of forethought on the availability of testing from the outset. Knowing that we're going to have an escalating number of patients and exposed healthcare workers, we were going to need a higher magnitude of tests. We are testing exponentially every single day in New York City and not keeping up with the need, which includes healthcare workers. So we are waiting days sometimes from the onset of symptoms to be tested because there just aren't enough tests for anybody.
Deborah, what are your members finding?
Well, that's the problem, is that nurses are being asked to work if they're asymptomatic, even though they know they've been exposed to the virus. They're asked to monitor themselves and still show up for work. So we're really concerned because we know that there are cases of the COVID virus that have been passed along, right, even though somebody was asymptomatic. So it's a huge concern for us. Yeah, we need universal healthcare worker testing fast now, yesterday, a week ago, 2 weeks ago. Dara Kass, Deborah Berger, thank you so much for making time tonight.